Hello, everyone, and welcome to RMD All Things Aesthetics and Wellness podcast with me, your host, Dr. Deborah Durst. And I have Brooke with me today, and I'm going to let her introduce herself. She works with us, and so if you're in the office, you see her on a daily basis. So say a few words, Brooke.
Hi, guys. I am Brooke. I'm the patient coordinator at Revitalize. And so I work in the front, and I also do a lot of the marketing stuff. So if you follow us on Instagram or Facebook, I have a lot to do with that, including Samantha. But I also deal with all the patients in the front. So I get to see people before and after all their treatments.
Yeah, so speaking of which, what is one of your favorite things? Since we didn't have a specific topic for today, and I was going to let you choose, what's one of your favorite things to see after somebody has a service done when they come to the front, whether they're excited or you're excited to see the difference?
I would say lip filler.
Yeah.
They come in nervous and or scared even, but also excited. And then after, you can see like it's instant gratification almost. They're excited about their lips. Sometimes there's swelling, but that fades. But yeah, I love seeing lip filler after
lips.
It's done.
Yeah, the before and after. And again, Brooke does a lot of our marketing, social media, before and after pictures, all of that. So she's in there getting pictures with it, and you'll see those on Instagram, and patients are always excited to see those after pictures for sure. So just a few facts about lips that you may not know. One of the more sensory-filled organs in the body. So it's got 1 million sensory fibers. So obviously more than the face, more than most parts of our body.
That's crazy.
And yeah, so it's a highly, highly sensual erogenous zone. And so it is an important one for attracting lovers, actually just a beautiful feature on a face, probably drawn to lips. I am.
Yeah.
I'm always checking out lips. I think everyone needs to have lips. Who doesn't need lips, right?
I agree.
Yeah. And so I'm always looking at them. And even the philtrum columns, those 2 columns that come down between the nose and the mouth and the lips, I'm always looking at those. Such a subtle sign of beauty. And another thing we can do with fillers is fill in or recreate those philtrum columns too. And it's very unique. Your lips are just like your handprint, your fingerprint. So just as unique as that. You only have one set of lips. And so whoever you're kissing needs to know your lips. They're that unique. And so you need to take care of them and plump them up and hydrate them, right?
Right.
Yeah. So that they recognize them when they feel them and when they see them. So just a few things about care for your lips. We don't have a lot of oil glands in the lips. And so they will, if we use too much in the way of petroleum-based or oil-based products, we also lose our production, so it shuts it down. So we don't want to do that. We want to keep them hydrated in other ways. So what's one of the good products, one of your best products from the front that you like to recommend after lip filler?
I would say SkinCeuticals has a lip repair that I always refer people to immediately.
And I love that product because it has hydration in it. So it has an HA in it, hyaluronic acid. So it hydrates, has a couple products that hydrate. And again, because we don't have that oil production and we don't have any sweat glands in our lips, that hydration is a huge thing that we need to do. But just like we take care of our skin otherwise, face, hands, we don't take care of our lips. We don't exfoliate. So we need to cleanse. We need to exfoliate them just like we do our face. And we're a huge, office for exfoliation. I love ZO line because it always, there's always an exfoliation step. And usually at least 2 times a week. But exfoliate the lips too. Get those dead skin cells off so your skin cells can function.
I think that's one thing that most people don't realize. Like I know exfoliating your skin is huge, but the lips, I think people just kind of forget about them.
That and sunscreen.
Yeah.
Yeah. And lip cancers do exist.
Yep.
And so using sunscreen too. So cleansing, exfoliating, using sunscreen, all those simple lip maintenance procedures that we don't even think about, those services. But then we get to the filler. There's other things we can do to treat the lips. So a couple other things. Brooke knows all these now. So what are some other things that we do prior to lip filler? And we'll get to that last.
PRF.
Yes. Perfect. PRF is a great one. Again, you're drawing your own blood, spinning it down and getting all those growth factors from the platelets. So if you want a more natural look and you want plumped up. And it actually is very helpful for bringing that color back too.
Yep.
We can potentially do it with filler. You can definitely do it at different times. You wouldn't want to do it at the same time because you'll get some swelling with the PRF. But that's an awesome way to naturally plump your lips if you're afraid of filler, which you don't need to be.
Yeah.
But.
I think another one that people get intimidated of filler. So I think Liplase would be a great place to start.
And that's a huge one on our social media too. When we run giveaways, and everyone is into the Liplase, which is one of our laser machines. Fotona does a Liplase, so it uses an erbium. It does an ablate. It's a non-ablative mode, and it just plumps them up to great prevent. But honestly, you can use it for a filler. It's not as plumping as a filler would be, but you have to do it multiple times.
Or I would say as long as lasting.
Yeah, no, it doesn't last that long, and you have to do it around 6 times, if you want to get a filling effect that lasts. But otherwise, you do it just pre-event, and you can get a few hours of some lip plumping. So that's an awesome one. That's great for brides to be, the day of the wedding, or start a month or 2 beforehand to plump, and definitely if you've had filler done for your wedding, then plump them up right before with the Liplase. So Liplase is an awesome procedure. And then filler, of course, and we have all kinds of different fillers that we use for the lip. I think the biggest thing is if you come in saying you want plumping, for instance, we don't know what plumping means. And I've had so many times when plumping meant something different to me, like a little plumping.
Oh, yeah.
It was just a little. And then they show me a little and it's, like
a
Kylie
lot.
Jenner. Yeah. And you can't get from where they are to where they want to go with just one treatment. Yeah. And so I think the biggest thing is bringing in pictures so that we can see your lips so we know what you want. Because what you're describing may not be my description of it. And so then you're going to go disappointed. So I would say whoever you go to, don't get so caught up in the names of fillers. Just know what you want to see as a result and then find someone you trust. And then you'll get those results and they'll choose the filler that's right for you.
I know on the phone, so many people ask me, how much will this cost? Or this is what I'm wanting. Like, what product would I use? And that is so hard for me to answer over the phone. So obviously I always refer them to come in and, show a picture of what they're wanting and then go from there. Because it might be a one-time thing or it might need 2 appointments and it could be different products, could be... There's a lot that goes into it.
There's a lot that goes into it. But
a picture definitely helps with finding the perfect fit.
Yeah, because if you give them a one treatment price and it's going to take 3 to get them where they want to go, unless we set realistic expectations up front, then they'll be disappointed, which we never want to see.
Right.
But you're right. And again, we don't do per syringe pricing for this reason alone, because we want to make sure that you're going to get one treatment at a time. We're not going to do more than a certain amount at one time, which is a syringe of filler. But we had lip flips on. We're doing a more comprehensive treatment. But if you need another treatment, then it's another cost. But what we don't want is to base it on one filler versus the other. We just want you to get that one treatment done and it's one price. And frequently we'll bring you back and do the lip flip after, 2 weeks after, which everyone loves because you're just looking forward to having a little plumping again.
Yeah.
And so you can get that with the lip flip. But yeah, beautiful results with it. Just don't get caught up in what filler you want. Do your research, bring your questions, but really what you want is pictures and just letting your provider know what you want. And then
the feel.
Trusting. Yeah, and the feel. Yeah. And again, what are some of the most common things you hear about not wanting your lips?
Overdone, like the fake or overdone look. That doesn't look like, my lips don't belong on my face, like that feeling.
Duck lips.
Another one is lumpy.
Oh, yeah.
Sometimes they said they've had it done somewhere else and it was very lumpy, like visible, and that they couldn't get rid of that.
Couldn't get rid of that. And so that's something, again, it depends on the filler too and the depth of placement. So it shouldn't be lumpy. You could smooth it out. And if it's one of those that have expression technology, like a Restylane product, then like a refine or define, you can pretty much smooth those out. But if it's something that is that doesn't have that and doesn't integrate into the tissue as much, then maybe superficial they get lumps, maybe too superficial they can get actually some Tyndall effect, which needs to be dissolved. But most of the time it's usually a depth placement. So And again,
Do your
we don't
research.
do your research.
There you
Make
go.
sure you go to a trusted provider, and we don't see a lot of that in the office at all. But I always hear, I don't want to look like that. Like, I don't want to look like that. And, that's, I think the bad rap that filler gets is because people don't want to look like that. And that's, poorly placed, overdone,
Or
all of the
it's
above.
what they've asked for. Like some people want that look, so that's
Correct.
So that's what they get,
Correct.
So other people are scared of it because of that. But
Yeah, because some people do like that look.
Yep.
And I tend to think that those patients probably do gravitate towards certain practices, which we don't do an overdone look. Like, I want you to look naturally beautiful. And so I don't want anyone to look overdone. But yeah, you're right. They do sometimes request it. And sometimes it's just a matter also of like getting it done too much. If it's not in the lip, it's in the wrong place,
Right.
in
Placement,
soft
big
tissue
time.
versus, down by the bone, all kinds of different things. But again, you're not going to look like that. If you bring in pictures, you go to a trusted provider and you just let them know what you want to look like at the end. Definitely, look for reviews, and get a feel for the office. I never recommend pricing stuff over the phone. You should at least get into the office and know that you feel comfortable with the office, feel comfortable with everyone there, and who's going to be injecting you before you proceed with the treatment. So,
absolutely.
yeah. So anything else you think we haven't covered?
I think so.
No. Definitely hydration. I would get rid of like your little lip balms that are,
I know. That we all love.
oil-based, petroleum-based,
Yeah.
because that's just going to pack on those dead skin cells, exfoliate, cleanse, and sunscreen. And then again, we have other different options that can lead you up to filler, such as, the PRF like Brooke was talking about, or Liplase, which is our laser procedure, which is awesome. And then filler. And Liplase isn't going to get you a filler effect. It'll get you plumping, mild plumping if you do it multiple times, but otherwise it's kind of a pre-plump for a special occasion. Or we'll do it because we do a giveaway, or we'll do like a food drive for, a animal shelter. And then if somebody brings in food, then they get a Liplase. And so it's a very popular.
People love that.
Yeah, people love it. So, well, if you have any other questions, just let us know. Leave it in the comments, like, subscribe, share with friends, and let us know what your experiences have been with lips, what your favorite product is, what you've liked about them, what you didn't like about them, and anything you want to hear about in the future. So, well, thank you, Brooke, for sitting in today.
Absolutely.
All right. Well, thank you for listening in. And we're here to, again, revitalize your lips, your look, your health, and your sex life. Thank you.